You can see some lymph nodes here. And now, after looking upon the submandibular gland, which appears normal, I'm coming down and I can see the two carotid vessels there and a lymph node, paracarotid lymph node anteriorly. This is the common carotid, and if I just release the pressure, I can see the internal jugular vein on the right side. So common carotid dividing into two, the internal and external. Usually, out of the two, the one which is laterally placed is the internal carotid, usually. And the one which is medially placed is the external carotid. We can always put color here and can see with the help of the spectrum they will produce which is the internal carotid and which is the external carotid. You are looking upon the spectrum of one of the two branches of the common carotid, where you see the peak systolic at around 40 and the end diastolic at around 20. Now we will see the other. This vessel was having a peak systolic of 40 and the end diastolic 20. So 40 divided by 20 is equal to 2. That was the systolic diastolic ratio. Now I am moving my sample to the other branch. And we can easily see now that peak systolic is taller while the end diastolic is much shorter. So peak systolic here is 63 and end diastolic is 15. So almost a ratio of 4 to 1. The previous one was having a ratio of 2 to 1. That was the internal carotid. And this one is the external carotid. Internal carotid is going to the brain. External carotid artery is going to the face as the facial artery. So let's see. This is the common carotid artery here, dividing into two. Why we should know which one is internal and which one is external is because that mostly, always almost, you will see the atheromas developing either in the internal carotid or in this bulb, the carotid bulb of the common carotid artery. Just see, longitudinally I have placed the probe on the common carotid, which expands here in this region. This is the bulb, and then this is the internal carotid. So mostly we will see atheromas developing here in this bulb or in the internal carotid. Another thing which we can notice here is the common carotid artery and its intima media thickness. I am enlarging the image for you, and you can appreciate now the intima white and the black media. Here also the intima and the media. We can measure it here. You see it is 0.4 millimeter or 0.04 centimeter. Normally in middle age we will find it in Pakistani patients 0.6 millimeter to 0.7 millimeter. But in diabetics and in hypertensives and patients having high cholesterol levels, etc., there is a predictive value of this intima media thickness in patients who are prone to develop myocardial ischemia in future. So this intima media thickness is helpful in predicting if we find it thicker than normal. This is in the common carotid artery. So there you see the common carotid artery, and lateral to it is the internal jugular vein. If we ask the patient to do Valsalva maneuver, bring his tummy out, forced expiration against closed glottis, you will see the diameter of this internal jugular vein will increase. पेट फुलाएं, पेट फुलाओ भाई, फुला के रखो, सांस नहीं लेना. There you see, it is growing bigger and bigger. ले लो. So in order to bring out or to make a vein prominent, we ask the patient to do this Valsalva maneuver. You can appreciate the one with Valsalva maneuver is 4.6 millimeter, and the one without Valsalva maneuver is 3 millimeter in diameter. So clearly we can see the same we apply anywhere in the body, whether we are looking upon the inferior vena cava or saphenofemoral junction, etc. We have seen the common carotid, the internal jugular, and also adjacent to these, you can appreciate these tubular lymph nodes, very frequently seen here. These are tubular lymph nodes, another over here, another over here, another over here. These are small lymph nodes, which are tubular. You see, they are tubular. Tubular lymph nodes are not active. They are not growing big. They are not enlarged. But if we come across round or elliptical rugby ball, if we find these lymph nodes round, yani spherical, or elliptical, like a rugby ball, and the diameter, if we find, is more than 1.5 centimeter or so, then we are worried. So you see, it still is a tubular lymph node here. There are multiple tubular lymph nodes. You can see here the sternocleidomastoid muscle, and now I am going into the midline to see the trachea. This is the trachea in the midline. This black is the trachea. The right common carotid artery is here. The left common carotid artery is here. Between the common carotid artery and this black round trachea with black shadow due to air inside, this spongy, bright tissue is the normal appearance of thyroid gland. This is the right lobe. You cross the midline through this isthmus and across you go into the left lobe. It is bright, spongy. Those of us who know the brightness of a fatty liver